The following program has been furnished and paid for by Ask the Expert Show. KSEV is not responsible for its content or the products or services offered. Welcome to the Ask the Expert Show with local experts in the field of health, legal, financial, and home improvement. Now, here's your host.
And good afternoon. We do welcome you to another edition of Ask the Experts here on AM 700 KSEV, the voice of Texas. I'm Jack Gonzalez, and in this session of Ask the Experts, we're going to talk about something very important to some of you listeners out there. Maybe you have a loved one who might need it. And we're talking about home health and hospice care. In just a minute to talk about that, Felix Cannibal with Avatar Home Health and Hospice Care. Thank you for joining us this afternoon for another edition of Ask the Experts, Felix.
Thank you for having me, Jack. I always enjoy coming in on Sundays and talking to whoever's listening out there about Avatar Home Health and Hospice. You know, I like to brag about a couple of things about my agency.
Yeah, go right ahead.
One of them is that we've been in business now for about 14 years now. And not a lot of agencies out there can claim that. We're not only Medicare and Medicaid certified, but we have received the gold seal of approval from the Joint Commission, which basically is the highest accreditation that an agency, a home health agency, can get. And if you check around, only 9% or less of the agencies in Texas have achieved that reward, that gold seal of approval. So we're very proud about that. And of course, today I think that we're going to get into some testimonials towards the end of the show.
Right.
These are very, very kind words that our patients have written to us. We also like to say that now we're accepting more insurance companies than before. I don't have the complete list because it's a long list of insurance companies that we do accept. So for those people out there, even if Medicare is not your primary payer, you can call us and we'll let you know whether your insurance covers you with our agency or not.
And that's something that's great. I'm going to interrupt you, that you will sit down and, not only provide the service of the home health and hospice care,
Sure.
but if they need some information as far as if they're covered and what type of help they can get other than just out of their own pocket, that's a service that you guys will provide as well, too, at Avatar.
Of course, and that's the reason I give out my number. And you're going to be calling me directly. My number is 281-703-8050. So you can always call me at that number. That's my cell phone, and also I'm proud to say that that's the kind of service that we give, Jack. I give out my number to all the families that we help. Right now we have about 400 and change. We're growing, even though we've been in business for 14 years. The last 6 months have been one of growth for our agency, and every single one of those families have my cell number. And that's the same number that my wife, my grandkids, my daughter called me on. So when you call me at 281-703-8050, you know that you're going to be talking directly to me. And it's not whether you need our services today or you need them tomorrow. Even if you have a question about anything that has to do with your health, I am not a doctor, but when it comes to medical equipment, assisted living facilities, small home groups, home health, caretakers, hospice, palliative care, any of those things that you might, doctors that visit you at home, any of those things, even though our agency doesn't provide all those services, I can point you in the right direction and let you know who can take good care of you.
And let's go into what the service is more detailed, as far as just a few touch bases on that to let our listeners know what kind of services you do provide. By the way, let's pass along, as you gave your phone number, the website as well as Avatar, that's AVATAR, avatarhomehealth.com. So if you'd like to go online and check out, and from what I understand from someone, a resident of my complex, it's a very good website as well, too. A lot of information there. So if any of your listeners would like to find out more, you can do that as well. Anyway, as far as the services that you'd like to provide to your clients, go over that just a little bit.
Right. Well, we're one of the very few agencies, and right now I cannot think of any agency in Harris and Montgomery County, which are the two counties that we primarily service. Even though we go up to Liberty a little bit because we go all the way to Cleveland, we go into Walker County, we go into Fort Bend County. So we go outside of Harris and Montgomery County, but I would say that most of our patients are in Harris and Montgomery County. We cover as, that's a large area.
It is.
That is a very large area. Mm-hmm. So wherever you are in that area or close to that area, we're going to be able to take care of you. But we do home health, we do hospice, and we do providers or caretaker services. And that's another thing that makes us very unique. Jack, it's very difficult for people who are not in this business. Anything that's healthcare related has a lot of regulations. It's like everything that we do is under the scrutiny of one of many federal agencies. If it's not Medicare, it's not Medicaid, the Office of the Inspector General. I mean, everyone have their eyes on healthcare. So so many agencies, what they do is they say, okay, I don't want to be dealing with all these regulations, so I'm going to do one. I'm going to be a home health agency. Or, no, I just want to do hospice. Or, okay, we're going to be a provider agency. So we're going to have caretakers taking care of the patients, right? So what we decided to do back in 2006 when we started the company was we're going to be a one-stop agency. And the idea behind that, Jack, was that if you are in home health and you need a provider, now you're going to have to call another agency. So now you have two agencies in your home. So when you have a problem with the provider, you call the provider, and the provider agency might tell you, well, that's your home health agency. They're supposed to be doing that. Or you call your home health agency and say, well, the provider's supposed to be doing that. So now you're bouncing between two agencies, and you don't know who to turn to. But if you're with Avatar Home Health, we're going to provide you with your home health, and we're going to provide you with your provider services. So if you call me. You got one phone to remember, one phone number to remember. Oh, somebody's calling us, so we better get that call. So you have one phone number to remember, which is 281-703-8050. And we'll take care of anything that you need.
And that is certainly helpful because we all know what a pain when you call a company, well, let me put you to this number. Yeah. Or they'll put you to a number and they'll say, oh, I'm sorry, we don't provide that. And then you just cut through all that, which of course could be very frustrating when you're trying to find out something for a loved one.
And nowadays it's even worse because then they tell you, well, go to the website. I said, no, I want to talk to a human being. I want to talk to someone, and that is very difficult. But also going back to our services, now let's take the same example. The patient is in home health. They go to the doctor. The doctor says, I'm sorry, there's so much else that we can do for you. And really, you should go to a hospice agency because we don't expect you to live more than 6 months. Of course, they're going to, they're not going to be as direct as what I'm talking about now. Right. But they're going to let the person know that, you have a short time to live. So you should get hospice services. So now they have to go and say, look for a hospice agency. So they already know our nurses because we've been providing them with home health. And they know our nurses, they know our therapists, they know our home health aides, they know the people in the office that they need to talk to. They got my number. So they got all these services in place. And now they have to call an agency, or they're referred to an agency that they never heard before.
And they got to start the process all over again.
They have to start the process all over again. Not only that, now it's going to be a new nurse, a new home health aide, a new person to take care of them. Why do that? If you're with Avatar Home Health, then we will transfer you to Avatar Hospice. You're going to keep the same nurse, the same home health aide. You're going to be talking to the same people in the office. When you need medical supplies or medical equipment, you already know who to talk to. So it makes life much, much easier. So that was our idea when we went into these three type of service agencies, when all the consultants back then that we were talking to help us to get the agency off the ground was telling us that we were crazy. Said, don't do this because this is a three-headed monster. You know, you go when you get things settled down in one side of the agency, the other side of the agency is going to be upside down or whatever. It's never happened. And the reason it's never happened is because we have an excellent, excellent staff. I've been very, very lucky to be able to hire some of the best people. And when I say best people, Jack, I'm not only talking about the education and their experience in the field, but people that actually care about their patients. And that is reflected in the testimonials that we get from our patients.
Yeah, and I remember we've read in the past testimonials about your customers have said about nurses, and you told me yourself that when you told them that you would no longer need to provide their care, that they were kind of disappointed because they didn't get to be seen by the nurses that they've created that bond with.
Oh, yeah, I'll tell you something. I have a more difficult time telling a patient that we're going to discharge him than when I'm talking to them to admit him into the agency. Because I say, no, but I want Maria or I want Donna to continue to come and see me every week. I said, well, you know, if she wants to see you as a friend, that's fine. But as a nurse, we cannot send her anymore because you're okay now. You're stable, and that's what we were hired for.
Right.
Because when in home health, it's an intermittent service, so meaning that we go there for 2 months or maybe 3, 4, 5 months. But eventually, you're either going to get better and we're going to discharge you. If you're going to get worse, then maybe you need to go into the hospice services. But, it's a temporary service. But anyways, we have excellent people, and that's the reason that something that we started from ground zero. Today, we help more than 400 patients. We employ more than 210 staff members, and I'm so very blessed to be able to help all these people that we help, because it's not only the money, because in other businesses we're making much more money than we make in home health and hospice, but it's a satisfaction that we get when somebody say, thank you, and thank your nurses. You don't have nurses. You have angels.
Oh, they've called them angels, huh?
And I tell you, that's
great compliment.
That touches very, very deep inside of people, and I'm just happy to be doing this.
And we're going to talk more with Felix about his services, and he mentioned testimonials. We have a couple of those we're going to read to you. Also, some other subjects regarding home health and hospice care. I'm Jack Gonzalez. That's Felix Cannibal with Avatar Home Health and Hospice Care. Stay tuned. We'll be back with more of Ask the Experts here on AM 700 KSEV, the voice of Texas.
Do you or anyone you know need help with your daily activities? Grocery shopping, bathing, cleaning, cooking? If you do, Avatar Home Health and Hospice can help you. Avatar Home Health can also help if you need nursing services and or therapy services in the convenience of your home. If you live in Harris or Montgomery County, in most cases, they can start services within 24 hours of your calling them. Avatar Home Health and Hospice was established in 2006. Avatar Home Health and Hospice is not only Medicare and Medicaid certified and licensed and insured, but is one of the few agencies that has received the Gold Seal from the Joint Commission. This accreditation has only been granted to less than 9% of the agencies in Texas. At this time, Avatar Home Health and Hospice takes care of over 340 patients. Whether it's home health, hospice, or caretaker services, one of their 220 professionals will be assigned to help you. Avatar Home Health accepts Medicare, Medicaid, United Healthcare, Aetna, Molina, Humana PPO, and other insurance companies. They also accept private pay patients. They can also help you find what benefits you qualify for. Most of their services are paid by Medicare, Medicaid, or your insurance company most of the time, without any out-of-pocket expense to you. Call Avatar Home Health and Hospice at 281-703-8050. That's 281-703-8050. Or email them at info@avatarhomehealth.com.
And we do welcome you back to Ask the Experts here on AM 700 KSEV, the voice of Texas. In case you're just tuning in, we're talking about home health and hospice care. And the man to talk to about all that is a man who knows what he's talking about when it comes to that. Felix Scannaball with Avatar Home Health and Hospice Care. I want to touch on a different subject right now, Felix. And we unfortunately hear a lot about this, and of course not with your company, because as we said before, you've got some great employees that a lot of your patients are happy to be with. Mm-hmm. But we do unfortunately hear a lot of news about abuse of the elderly.
Right.
How much abuse is actually out there?
Well, that for me, that's hard to say, but there's more than people want to admit. Uh-huh. We run into a lot of situations, and unfortunately, most of the times, these people are old, they're sick, they need help. Mm-hmm. Sometimes the only help they're getting is whatever help they get from a neighbor or relatives of them. So they feel that if they tell on the person that is kind of, say, abusing them, then they're going to lose the only person that's really close to them. You see, so to begin with, the number one problem we have is that they deny it. Right? But when our nurses, our therapists, our home health aides, they get into a home and they see a situation where the patient there's three areas. When we talk about abuse, there's three areas that we look at: abuse, neglect, and exploitation. And abuse, of course, abuse is when, somebody's being physically abused, sexually abused, verbally abused, or emotionally abused, or
mentally abused.
Exactly. So that's the abuse that we look for. The negligence is nobody cares about that person. Nobody's helping that person. That person has nothing to eat in the pantry. The refrigerator is empty. The house is very, very dirty, or the house. The person has been accumulating stuff for 30 years.
Kind of like hoarding, in other words.
Hoarding, and they can hardly move inside the house.
Right.
So we have that. And then we have exploitation. That has to do with somebody coming to their home and getting into that person's, checking account, or they get their retirement check, or somehow they're stealing money from that person. They're stealing their goods. Jewelry, they're stealing the medicines to sell them in the markets, let's say.
So you've seen incidents like that?
Oh, yeah, yes.
Really?
Yes.
I haven't heard of that part.
Yeah, believe me, in 14 years, we've seen almost everything, all right? And then, of course, our recourse, first of all, is we talk to the person that's being abused. And we try to get a feeling of how they feel about it. Are they aware that is happening? Or, because sometimes, like, say if a person is getting a Social Security check, and we look and there's no money, no food in the pantries, no food in the refrigerator, and we ask the person, says, who buys the groceries for you? And they might say, well, my neighbor does. And how do they do it? Well, I give her my credit card, and then before you know it, you go. You're looking into something and say, well, so where's all this lady's money going, because there's no food? Right. So whatever. So what one of the options that we have is to get APS, the Adult Protective Services, involved.
Okay.
And if we see that we cannot help, basically, and that decision has to be made on the spot, because we have 24 hours by law to report a case of abuse, negligence, or exploitation. So it's not whether we want to or not.
Right.
We have to report the case, unless when we talk to them and the family comes and say, oh, I'm sorry, we didn't notice. Or if we see that it's fixable, that it's being fixed, that's fine. Or if it's an oversight, it's okay. But if it's really happening on purpose, or because the person has no resources, then we do make the decision, and we get Adult Protective Services involved. That, by number one, that's what the law requires. Number two, now we know that if we're not able to supply the help they need, Adult Protective Services will find an agency, or they find somehow to help them out more than what we can. So, but it is out there. I don't have the information to give you. Well, it happens in 80% of the times or 20% of the times, but it happens more often than what.
And even if it's just a small percentage of the time, it's terrible. No matter what the number is, and something like that has to be taken care of, because you said a person lives alone.
Yeah.
You know, if they're not eating, they're not getting proper nutrition, or so it's
exactly.
You're looking at some future hehealth matters that, who knows, could be dangerous as well.
Oh,
too.
no, of course. I have some horror stories that I choose not to share with people.
Sure.
But we've been there. But what I'm glad to report to you, Jack, is that in most instances, once we get involved, I would say 99.9%, if not all the cases, the situation improves.
Good.
Because even if we just talk to the relative and say, look at the conditions that your aunt or your mother or your grandmother is living under, can you help us help her? Mm-hmm. And then we make them part of the team.
Sure.
You know, it's not like we don't want to make them feel guilty and start an argument with them or anything. We just try to get them to help us take care of the person. Now, they know that they're accountable to us. Mm-hmm. Because we're going to go and say, hey, how are you? We're going to keep in contact with that person. And then most of the times, the people realize that, yeah, this is what I should be doing for my mom, or this is what I should be doing for my grandma or my aunt, or even my neighbor. You know, because after all, you know, we're here to help each other.
Right, community and everything
exactly.
Like that. Sure.
So in most cases, things improve, and in many cases, they improve a lot.
So when you spot that, when your employee goes out to the home, so
right.
What is it? Initially, they set up an appointment, they say, we're interested in your services, we'd like to, and then you come to the home.
Right.
So that's the way that kind of all kind of goes.
Exactly.
Into, you're not just there to talk to them about, hey, what kind of service you can provide, but then if you get there and you see, oh my gosh, look at this situation, that's how that is spotted, correct?
Because in some cases, or in most cases, it's obvious. You walk through the door. I mean, you approach the door, and you smell the stank of smoke, right? Because it's a heavy smoker, and then you go, wait a second, this person is on oxygen. Mm-hmm. So that's a ticking bomb. You know, that's an accident waiting to happen. So you go in there, the person has the oxygen, and they take it off for a few minutes, and they start smoking right next to the oxygen bottle. And you go, wait a second, sir, why do you move before we blow up? You know, or you go there and you see dog feces all over the place because they have 2 dogs and nobody cleans after the dogs, or you know, urine smell, and because the lady or the patient, they don't have, let's say they don't have diapers, or they don't change, or they don't have anybody to help them take a bath, so they don't bathe.
And that's all the services that you guys provide.
Exactly. We provide all of that, or we can help with all of that.
Sure.
So right away, I mean, the food thing, there's no food in the pantry, no food in the refrigerator, and you getting a monthly check. After you pay your rent, you should have $400 left. What's happening to that $400? Mm-hmm. And many times they say, I don't know, my nephew takes care of me, or my daughter takes care of me. So then we have to talk to the nephew or the daughter and say, there's no food here. Mm-hmm. And that's a case where almost that case is going to be reported, you know.
Now, can these people who abuse, I mean, I hate to think of family member going to jail or anything like that, but the abusers, I mean, is this something that they might end up in jail
for? Of course. It depends on the crime, but, you know, you're sure, for sure. Because if you're abusing a person physically, sexually, forget it. You know, if you're stealing their money. Now, what happens, Jack, is that in most of these cases, the victim is not going to press charges. Okay, but at least even if they don't press charges, the one that's committing the abuse or the exploitation, now they better change their behavior, or they know that maybe next time this person is going to press charges
against them. They know there's somebody watching them,
exactly.
And that's very important.
Exactly. So yes, it happens. But again, and if that's another reason to call me.
Right.
If you know of anybody that's being abused, or you think that they need help, or you don't know how to help them, or they say they're in a wheelchair, the wheelchair is broken, call me. Call me at 281-703-8050, 281-703-8050, and I'll be more than glad to help you or help that person. That's what I do for a living.
And I'm sure a lot of people appreciate that. In fact, we only have a couple of minutes left, so I want to read one of these testimonials.
Oh, sure.
From one of the people you care for. Dear sir or madam, I am 75 years old and very thankful for the services provided by Miss Dana, or Mrs. Dana, it looks like here, the social worker. She is pleasant, caring, and understanding. She gave timely care and make me feel loved and is always caring. Thanks. And that, once again, folks, is what we're saying when we talk about people who really appreciate these services and they create a bond. In fact, another one here to the staff at Avatar, perhaps you sent a lovely card or sat quietly in a chair. This is one I really like. Perhaps you spoke the kindest words, as any friend could say. Perhaps you were not there at all, just thoughts of us that day. Whatever you did to console our hearts, we thank you so much, whatever the part in the family of and Captain William they put on here. So that was a really nice testimonial there. You didn't have to twist him by the arm or anything. That was just very heartfelt of how they felt about you, your caregiver, and your services, Felix.
Actually, I'll tell you, now that people know that we're doing the radio show, because we've been doing it now for over a year and a half, people call me and they tell my assistant, say, "Oh, tell Mr. Felix if he wants me to go on the radio show with him. I'll tell the world what good of an agency Avatar is." So I have plenty of volunteers to come on the show. So that's something that we might be incorporating in our shows more often now.
Right. It's very important so people understand. Like we said, it's not something prefabricated. These are really spoken from their heart. That is Felix Scanabar with Avatar Home Health Care. Give your number again one more time before we sign off, Felix.
281-703-8050. Call me at any time.
And once again, that website is going to be Avatar, AVATAR, homehealth.com, avatarhomehealth.com. Thank you for joining us for another edition of Ask the Experts here on this Sunday, Felix. We thank you for it.
Thank you. Thank you for having me.
And we thank you, our wonderful KSEV listeners, for tuning in. And we will be back next time for another edition of Ask the Experts right here on AM 700. KSEV, the voice of Texas.
Thanks again for tuning in for another Ask the Expert show right here on AM 700 KSEV.